Howdy, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
I thought that's
Bob.
kind of a cowboy introduction there. Howdy, folks. Anyway, today we're going to talk about tension headaches and a remedy for it that you can try without using pills. Because I know a lot of people are trying to get away from the pills.
Right. And Bob, I thought about this yesterday because I had a patient that this worked so well with us. I was so excited about it. So we got to get this on video.
Cool.
This is going to help people, across the country
It's
and the world.
definitely a good thing to try.
Right.
It may not be the answer for everybody. I
Right.
think for everybody, for most people who have true tension headaches, it's going to help.
Right.
It may not take it away completely.
Right.
But it's certainly one thing that I would try.
You bet.
So-
In this case, the woman came in, she had been working at a desk for many years,
Yep.
at a computer workstation. She had stopped that for some other reason we don't care about, but her headaches would start here, and then on a busy day, she said by the end of the day, they'd wrap up all the way across into her forehead. So if you've got those symptoms here and they wrap up with activity, this could be the thing just for
Kind of a
you.
tension headache, full wrap headache you call it.
Right.
I've seen it also where it just comes up one side.
Sure.
Yeah,
Yep.
and this would be the same thing.
Okay.
I would,
So
Right.
I did a simple assessment, and not too long, I thought we got to try this tennis ball technique.
Yeah.
Now what we have is nothing more than your standard tennis ball here, and you put it into a sock. Clean sock is best.
Right, and you have two of them in there.
Right, there's two of them in there. Okay, why don't you lay down, Bob? And this is exactly what I had her do. Now, this is a massage table, it's a little soft. You will not want to do this on bed or anything too soft. Carpeted floor works the best, or unless you have a plinth for therapy, which most people don't have in their house. And you just simply take the tennis balls, they're about that wide apart, okay? Lift your head up, please, and you're gonna put them right back. Go ahead, lay down. It's the suboccipital region, you don't need to know that. And the nice thing about this, as I told my patient, this was Tuesday, I said, just lay down and move those tennis balls so it feels good. And that's exactly what she did. Go ahead, Bob. Can you
Right,
adjust that?
Exactly. Actually, where you had it to start is about where I liked it.
Right.
But you may even move it over time. You may have it here for a while, right, Brad?
Yeah, it may, you go by symptoms. Let symptoms guide how you work with these balls. In her case, I put it there and she said, boy, that feels kind of good. So I turned my timer on and we left it on for 3 minutes. Continued to feel good. So her home exercise program was simply lay down, put the tennis balls behind your head, lay there for 3 to 5 minutes. Do that 3 times per day.
And then maybe adjust it, maybe a little bit.
Exactly, adjust it as tolerated, and her results the first day, 75% reduction. But I saw her a week later and they maintained 75% of her headaches were gone, and she could control them by this exercise. After that, I gave her another exercise like this, the chin tuck, to help stretch those muscles, particularly when she's driving or sitting at the workstation, the computer in her house. So this is it.
Yeah?
If you got tennis balls laying around, you can try it. If it doesn't work, go
Yeah,
to the next.
you're not out.
Right,
anything,
costs you nothing, and it's a great idea. So Bob, I think people should subscribe to us, right?
That's right. If you haven't already, we're going to give you videos on how to stay healthy, fit, and pain-free.
And then I always like to do this. Watch out. Oh!
All right.